target a large number of people. Biological agents used for terrorism are usually found naturally, but they can be modified to become more virulent or resistant to antibiotics. So scientifically, they can take these microorganisms and change them up to make them much more dangerous. Since 9/11, we've had a heightened concern of use of microorganisms as a mean of terrorism. Biological warfare agents are often colorless, odorless microorganisms. They include bacteria, fungi, viruses, and toxins. They allow easy escape and they can cause massive panic. The CDC categorizes bioterrorism into 3 different categories. Category A has the highest risk and poses the greatest threat. Healthcare workers are going to be the first to respond to bioterrorism, so as nurses, we would bear a lot of the weight on our shoulders from all of the panic and all of the overwhelming patients that would come in if this were to ever happen. This is just a chart to show the most dangerous. These 3 are the most dangerous. Anthrax, the plague, and smallpox. The incubation periods, 1 to 6 days for the plague, anthrax, and 7 to 17 days for smallpox. And again, the most serious threats are smallpox, anthrax, and the plague. Okay, I'm going to start talking about smallpox. It's caused by the variola virus.
You touched one of those buttons.
Structurally, it's very large and complex. It can spread easily from saliva droplets or it can travel through the air. Smallpox only affects humans. The last case was reported in Somalia in 1977, so the virus has been wiped out. So the vaccine is no longer given, although military personnel and some healthcare workers may still need to receive the smallpox vaccine. And it is expected that the viruses may be contained in biowarfare laboratories around the world. Something interesting that I found, a scientist in 1939 found that the smallpox vaccine that was the same as the cowpox vaccine, remember when we talked about that, how they matched them up and used that it had somehow changed and that was no longer effective. So then they needed to use the variola vaccine for it. The symptoms typically start anywhere from 7 to 17 days. The first symptoms you're going to have are malaise, fatigue, sweating, nausea, vomiting, diarrhea, headache, and a fever. 2 to 4 days after those initial symptoms, you can start to get a rash. And it starts to appear as small bumps. You can see in this picture it progressively worsens. It starts in the mouth and it spreads to the hands and feet and all over the body. And then once the scabs fall off, they leave scars, damaging scars all over the body. Once the symptoms have started, the treatment is limited. For variola major, the mortality rate is 30%. There's 2 types, variola major and variola minor. And the virus can live outside of the host for 6 to 24 hours. So that will make it even more dangerous. Anthrax is an infectious disease caused by Bacillus anthracis, which is a gram-positive endospore-forming rod bacteria. The infections in humans most involve the skin, the GI tract, and the lungs. It's commonly affected hoofed animals, which is dangerous for farm workers and people that work around those animals that work with maybe the skins. It can travel and infect the humans. The 3 routes of infection are cutaneous, inhalation, and ingesting. Cutaneous is the most common. It occurs when the anthrax spores come in contact with the cut or a scrape on the skin. Breathing it in, the anthrax spores enter the lungs through the respiratory tract. The bacteria spores take 1 to 6 days to germinate before the illness occurs. Once the spores germinate, they release toxic substances which can cause internal bleeding, swelling, and tissue death. Or you can ingest it from eating bad meat. Signs and symptoms for cutaneous anthrax are an itchy sores, usually painless, but accompanied by significant swelling, and the scab falls off within 2 weeks. The signs and symptoms for inhalation anthrax are fever, malaise, headache, cough, shortness of breath, chest pain, and shock. The signs and symptoms for gastrointestinal anthrax are abdominal pain, bloody diarrhea, fever, mouth sores, and nausea and vomiting. for anthrax are treated with antibiotic therapy. The most commonly used antibiotics are penicillin, doxycycline, and ciprofloxacin. Ciprofloxacin. Treatment usually lasts 60 days because the spores can germinate. So so a 10-day antibiotic wouldn't be effective because the spores can still be germinating inside you and still cause illness. Cutaneous anthrax is treated by taking oral antibiotics. Treatment is usually successful. However, there's a 20% mortality rate of untreated patients once the anthrax enters the bloodstream. When treating inhalation anthrax, a combination of drugs is used, usually Cipro and another IV medication. I couldn't find the name of the other IV medication, but it would be a combination of drugs. GI anthrax, also treated with antibiotics, can enter the bloodstream and lead to death. I just found a little side note about that. There's another, I don't know if it was the same as ingesting it, I'm sure it is, but it can just cause fluid retention and fluid shift and ascites, and it can lead to shock and death. I didn't go into this a whole lot because I know we had a project about it yesterday. It's a Category A bioterrorism threat caused by the gram-negative bacteria Yersinia pestis. The signs and symptoms are headache, fatigue, muscle aches, and fever. Your lymph nodes become remarkably large and you develop the buboes, and there's a 60% mortality rate if it is not treated. This was a picture of an infant starting smallpox. They start around the mouth and the face, and some of them were really bad. You couldn't even, it was really hard to tell a body. It was under all of the bumps. It was really sad. This is cutaneous anthrax, and this is, I believe, anthrax, a culture.
Question.